everyone. This is Dr. Aftab Ahmed, MD Internal Medicine and Consulting Physician, Government Medical College, Jammu. Today I am going to talk about the latest update in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular diseases, which affects 45% people in the age group of 40 to 69. Raised blood pressure is among the most important risk factors for cardiovascular diseases. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow up. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of the people, are 51% of the men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. International Society of Hypertension has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempt to address the issue that in resource-poor settings. Optimal care refer to evidence-based standard of care, and whereas essential standards refer to minimum standard of care, to allow specification of essential standard of care for low resource setting. The American Heart Association and American College of Cardiology has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low atherosclerotic cardiovascular diseases. Among low risk with stage 1 hypertension, management start with non-pharmacologic therapy. If blood pressure remain uncontrolled at 3 to 6 months, consider starting pharmacologic therapy. Acute respiratory distress syndrome is a potentially fatal condition involving lung damage and experts often associated with severe COVID-19 pneumonia. A recent study which appeared in the Journal of American College of Cardiology reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to 110 to 130 millimeter of mercury range substantially reduce cardiovascular adverse events in the STEP randomized trial. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European Guidelines on the Management of Atrial Hypertension recommend that the diagnosis of hypertension should not only be depend on office BP monitoring, but also on out-of-office measurement, such as ambulatory BP monitoring or home blood pressure monitoring. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European Guidelines equally recommend 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combined treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European Guidelines recommend, especially in the context of lower BP targets, to start antihypertensive therapy with an initial fixed dose combination of ACE inhibitors or ARBs plus calcium channel blocker or diuretics. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a non-carcinogen, namely NDMA, which can be found in candesartan, valsartan, losartan. MDA has been classified by WHO, International Agency for Research on Cancer, to be carcinogenic in humans. Thank you very much.